Hello there, my name is Brian Shoemake. I'm a food animal veterinarian with the University of Missouri College of Veterinary Medicine. And today I'm going to be talking about preventing calf diarrhea with a rotational grazing system for our virtual field days. So let's get started. First question is, who's ever had a calf diarrhea problem in their calves, especially somewhere between the 2 to 6 weeks of age range? Typically, we can see calves with dirty rear ends or tails with manure and diarrhea staining back there. Especially looks like this, usually yellowish to brown. Every once in a while, it'll come out white like this poor calf here. Based on the information that's been gathered over the past 20 or 30 years or so, it's a common theme that calf diarrhea or digestive issues are a common cause of death in calves. So in 2007, the USDA conducted a study of cow-calf producers, and diarrhea was one of the top 3 known causes of calf diarrhea in neonates, so something that's 3 weeks of age or less. So we had birth-related problems being a neonatal issue, weather-related causes as a cause of death in neonates, and then digestive problems being the first real illness-related issue in neonates. And that's if we exclude the causes that we just don't know why the calf died. And then if we look at calves that are 3 weeks of age or older, then diarrhea or gastrointestinal problems is in the top 2 causes of death in those calves that are older than 3 weeks. So we have had an issue with calf diarrhea. And in 2015, that issue still persisted. So this isn't something that is uncommon or changing. So in calves that have made it past that 3-week age for this particular study, respiratory problems is the #1 cause of illness. And then calving related problems. So those early calving related injuries or issues such as dystocias. And then digestive problems is still #3 in cause of death in calves of all ages. Some of the common causes of calf diarrhea are probably not unfamiliar to us. The viruses are typically one of the more prevalent causes, so rotavirus and coronavirus. And this is not the COVID-19 coronavirus. This is a coronavirus that is specific to cattle. That causes gastrointestinal type complications and illness. And then bovine viral diarrhea virus can cause diarrhea, as the name implies. These are all common pathogens or infectious causes of diarrhea in calves that are greater than 3 weeks of age. There are also bacteria that can cause diarrhea in calves. E. coli is typically a very young calf, so 5 days of age or less, while Salmonella and Clostridium can typically cause disease in calves that are greater than a couple weeks of age. So again, in that greater than 2 weeks of age, Salmonella or Clostridium might be a cause of diarrhea in those calves. And then there's some parasites that cause diarrhea as well. The one that's most significant in calves is Cryptosporidium. We have to pay particular attention to this one because it can also cause diarrhea in humans. So this pathogen is common in the environment, it's common in cows, and the calves actually probably acquire it from their cows or just out in the environment. But as those calves have diarrhea and as humans are interacting with them and trying to treat them, they can also acquire this infectious pathogen from those calves. So be careful if you yourself start exhibiting similar symptoms to the calves. Go get checked out by a physician and stay hydrated. Like I already somewhat mentioned, calves are going to acquire most of these diseases from their cows or other cows out in the pasture and the environment. And then as these calves acquire those pathogens, they not only just acquire the disease, but they're also going to amplify the virulence and the pathogenic load that is present in the environment and exposure to other calves. So if we look at this visually, this cow is probably passing just a very low infectious load. Same thing for this cow here. Small infectious load is coming out with her fecal material. But then when this particular white-faced calf gets exposed to that, it's not just going to redistribute a similar load, it's going to amplify the pathogenic load and presence of that pathogen there, whether it be a virus, a bacteria, or a parasite. So calves and almost all neonates of any species are a biologic amplifier, meaning that they increase the presence of disease in the environment. As that diarrhea progresses, calves can get really sick and can become to the point where they're recumbent or unable to rise, meaning they can't stand up, they can't walk around, they can't nurse, they can't really do anything to help themselves get better. And once they're down and lateral like this, it's difficult to treat and especially more expensive to treat at this point, because we typically have to administer IV fluids, correct any internal disturbances that are happening with their electrolytes and acid-base status, because that diarrhea does get them in a very bad place as it progresses. If we can treat a calf when we start seeing the diarrhea with just oral fluids and electrolytes alone, then we can help this calf and prevent it from turning into this calf. So just oral electrolyte solutions that are specifically designed for calves that have the electrolytes that they need that they're losing in their diarrhea can keep them up on their feet, keep them nursing on their cow, and prevent the more expensive and exhaustive treatment modalities that we have to deal with. So treating calves like this is definitely viable, but if you've got a really severe calf diarrhea outbreak, then you could be looking at a significant percentage of your calves needing some sort of oral electrolyte solution. And so if we could prevent that altogether or reduce the amount of calf diarrhea, then maybe we don't have to provide oral electrolyte supplementation, and we can just let the calves nurse on their cows like we're intending them to from the get-go. And so that's really the point of this presentation or discussion, is that the Sandhills calving system, which is a rotational grazing system or modality, can reduce the amount of calf diarrhea by reducing the amount of pathogens that are present in the environment. So I'll go through a rotational grazing system scheme and then demonstrate how that prevents the pathogen load from accumulating in the environment. So to do this, we are going to need separate individual lots or pastures or paddocks or different places that we can confine and manage cattle. And so when we're going to start this, we'll move all of the pregnant cows into this first lot, and we're going to let them calve there for about 2 weeks from the date of the first calf that's born. And so that first calf is going to get up to about 13, 14 days of age. And then we're going to move all of the pregnant cows. We're going to leave all of the pairs that have already calved in that original pasture. And that way, as these calves age and get older, then they will be in an environment that they've grown up in. But more importantly, this lot number 2 is a very clean environment for any newborn calves to be born into. This 2-week-old calf that's still in lot 1 is going to start shedding pathogens that a day-old calf is not ready to handle. And so we've got these pregnant cows in lot 2 now. We're going to let them calve for a week, and then we're going to move the pairs again. Let them calve for a week, move the pairs again. And then finally, leave the pairs, and then move those last sets or last cows that are still pregnant and finish out calving. And so this way, the calves that are born in lot 5 have as clean of environment as the calves that were born in lot 1. If we just left all of the cows to calve in the same lot or pasture, then the environment is going to keep getting dirtier and dirtier, and more infectious material is going to be present in those lots. So by moving the pregnant cows into a clean environment, the calves are going to have the best, cleanest environment that they can be born into, and then those early days can have the best opportunity for success and health. And so we're going to prevent the exposure to those infectious diseases, because if we look at these graphs, we've got time on the x-axis, we've got exposure to infectious material on the y-axis. And so in a conventional calving system, or where we have no separation of young calves from older calves, then the infectious material is just going to keep increasing. And it's not a linear increase, it's a very exponential increase. So by the time that the last calf is born, there's almost no way that it isn't going to be exposed to that infectious material. And that newborn's immune system cannot handle this. The presence of infectious material is going to be greater than its immune system or any colostrum is going to be able to handle. Whereas by using the Sandhills calving system, if we have the same period of time and we track exposure again, if this is the first lot, as the calves are being born, yes, the infectious material still accumulates, but it's going to have to stop because newborn calves are no longer exposed in that area because they've moved on to lot 2, and the infectious material load is back down to negligible. Again, it's going to increase, but we're going to move the pregnant cows before the infectious material present in those lots gets to be burdensome or overwhelming. Now, this plan is not something that can just be implemented without any thought. We definitely need to address a few things. Some of those that I've thought about, and this is not an exhaustive list, but you have to have grass or forage available for these various lots, pastures, or paddocks. You got to have enough space in each one for the number of pregnant cows that are going to be moving into it. And so that takes some planning, as any rotational grazing system does. Likewise, have to have access to water. And this is probably one of the major challenges of a rotational grazing system sometimes, is getting water in all of those individual lots, especially if this is the first time that you're doing a Sandhills system. It also helps to have a confined calving season. So if you've got a calving season that's 30 to 60 days, you can probably pull this off. But if you've got a calving season that is prolonged and starts taking 4 or 5 months, then it might be more difficult to have that many clean pastures or paddocks. Now, eventually you can move back to that first initial lot, but it's going to take time for those infectious diseases to be removed just by rain and sunlight and things like that. And that can take upwards of a month or 2 to get enough UV light exposure in the summer. In the winter, it's probably going to take a little bit longer during those cooler seasons. And other things that are important is, are you going to have access to a barn or facility? So this is a very nice, clean picture of very rectangular lots, and property lines probably don't always allow for this. But where does your barn fit in this management scheme? Does it need to be somewhere around lot 3 so that any cow has a fairly equal distance to get to it? Or this is where producers and people that manage cattle have to get creative with how these rotational systems work around their property, so that if you do need to have a chute or a small calving pen so you can handle a cow, if you need to help pull or some other sort of assistance, that's available. Some people have put just small pens in each lot with a portable head gate that they can catch the cow up if needed to help. Other things to think about is, how close is this to the house? If we're gonna have to be watching them frequently because we're worried about dystocias or calving difficulties and things like that. And then once the calves start reaching somewhere between 30 to 40 days of age, we can start regrouping them and reforming that larger herd, because they do all need to get back together, because managing one herd is easier than 5 smaller groups. So a little bit of planning needs to go into a rotational grazing system, and specifically the sandhill system. Are those areas going to be able to contain calves, and are you going to be able to intervene when needed, are some of the more important things that we need to think about. So if there are any other questions, I am more than happy to try to address those. My contact information is listed here. My email address might be the easiest way to get in touch with me. Typically fairly responsive to email. And then phone number, this will get you to the food animal medicine and surgery main phone number, and they can direct your phone call my way, or if for some so my contact information is listed here. Email is probably the best way to reach out to me, and I can call you back if needed, or a phone number. This gets you to the main food animal front desk reception area, and they can forward you on to my office number. Contact information. My contact information is listed here. I'm more than happy to answer more questions if you have them. Email is probably the best way to get in touch, but phone number is also listed as well if that works better. Hope you found this useful information, and if you end up trying this for the first time, please let me know how it works out. We do like to hear success stories, but also what problems or complications came up and where can we make this a better system for our Missouri cattlemen. Have a great day.